right, welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we welcome back Anthony Avellino. He is a pediatric neurosurgeon, and his book is titled Finding Purpose, A Neurosurgeon's Journey of Hope and Healing. We're going to talk about his latest Kevin MD article today titled New Legislation Addresses Healthcare Professionals' Mental Health Needs. Anthony, welcome back to the show.
Great, Kevin. I'm very, very honored, and I truly appreciate the opportunity again, because your Kevin MD platform really provides many to share.
And obviously, I couldn't do it without guests like yourself. So thank you so much for coming back. Now, for those who didn't get a chance to listen to our first episode together, just briefly share your story and journey to where you are today.
Sure. So I'm a pediatric neurosurgeon, an experienced healthcare administrator, and endurance ultra runner who has battled with depression, obsessive compulsive tendency, suicide, and stuttering as long as I can remember. I graduated Columbia University College of Physicians and Surgeons. I say that because Dr. Lorna Breen was an ED doctor there. But really, the COVID-19 global pandemic has made many of us experience fear, anxiety, depression due to the isolation, lack of structure, financial uncertainty, new work from home realities, childcare pressures, elder care pressures, and working long hours. And really, my story in becoming a neurosurgeon, I sought to live a life bringing healing to those with neurological disease. After completing my neurosurgery training at the University of Washington, I felt a tremendous sense of pride knowing that I was prepared to have a great impact on patients and families in their time of greatest need and hopelessness. I entered in each day with the knowledge that I've given my all. I, like many of my colleagues, though, ignored the fatigue and underestimated the accumulated trauma and stress until suddenly I became one of those stats. I was burnt out, depressed. The administration, clinical, and personal stressors struck down my physical and mental health. So on September 12, 2009, I attempted to actually take my life. But through that experience and through the employee assistance program, I gained a greater understanding of what my purpose was. And really, my hope is to help people find self-coping skills because, as you know, healthcare provider burnout, nursing burnout is real. As I often say, we have 1 million physicians in the United States. Conservatively, if 40% are burnt out, we have over 400 physicians that are burnt out. And so that's truly a public health crisis.
So you're in one of the most demanding fields in pediatric neurosurgery. As you reflect back on your career, how's the situation as it relates to burnout in your field now compared to, say, 10 years ago?
Yeah, I truly think that navigating the COVID-19 pandemic has really helped many healthcare systems realize that healthcare burnout is real. And really, it gave the executive teams at many healthcare institutions the ability to pause and really bringing healthcare worker wellness to the forefront. Because I don't think we're buying into the concept, but I think the COVID pandemic has given people the opportunity to pause. And I think healthcare systems are now really bringing awareness to wellness and developing strategies for healthcare workers, because I think people are realizing that with over 40% of physicians burnt out, is having the ability to provide better self-coping skills is actually really important.
So we're going to talk about the Dr. Lorna Breen Healthcare Provider Protection Act during this episode. But before we get into that, tell us a little bit about Dr. Lorna Breen and who she was.
Yeah, so Dr. Lorna Breen was a well-respected emergency department physician at New York Presbyterian Hospital. She was one of those frontline heroes we heard so much about during the peak of the COVID-19. She was in the ED helping many patients infected with the COVID-19 before vaccines were available and when personal protection equipment was in dangerously low supply. She was working long hours. She was exhausted, and then she contacted the virus. She quarantined at home. Right after she recovered, she was back at the hospital helping others. Sadly, though, the weight of the pandemic, the longer hours, the isolation of being home, the exposure to much loss of life really took a toll on her, and she took her own life on April 26, 2020.
So her legacy is memorialized with the Dr. Lorna Breen Healthcare Provider Protection Act. You talk about that in your Kevin MD article. New legislation addresses healthcare professionals' mental health needs. Now, for those that didn't get a chance to read your article, just walk my audience through it and share the story of why you decided to write it.
Yeah, so I think starting with the stats, because I think the stats give the opportunity for people to pause, but each year almost 400 physicians die by suicide. Reading that sentence should be enough to give anyone who has dedicated their life to helping and saving others cause for concern. As you know, medical students' rate of depression is 15 to 30% higher than that of the general public. Physicians are more than twice as likely to take their own lives as the general population. But what's more important and more concerning is female physicians are 2.5 to 4 times as likely to die by suicide than women in other occupations. So these are national stats, and we can and should do things differently. If we recognize and reduce the stressors that lead to burnout, we can create supportive environments that foster our own physical and mental well-being. And so what the Lorna Breen Healthcare Provider Protection Act provides, the U.S. government took an important step to address the high incidence of healthcare professionals' burnout, depression. On March 18, 2022, President Biden signed into law the Dr. Lorna Breen Healthcare Provider Protection Act. The law provides several requirements for the Department of Health and Human Services. Key among them are really fourfold. One, the act provides awards grants to hospitals, medical professionals, associations, and other healthcare entities for programs to promote mental health and resilience among healthcare workers. Two, it awards grants for relevant mental and behavioral health training for healthcare students, residents. Three, it develops and implements an awareness campaign to encourage healthcare professionals to seek support and treatment for mental and behavioral health concerns. And lastly, what it does, it disseminates best practices to prevent suicide and improve mental health and resiliency. And so really what it does is a few things. One, it raises the awareness of mental health. Hopefully it removes the stigma of mental health, so physicians and nursing staff and healthcare workers have the ability to seek help.
So correct me if I'm wrong, but this is one of those rare pieces of legislation that was passed on a bipartisan basis. Is that correct?
Right. Yes, it was. And the importance of the act is really it gives the public and healthcare entities the ability to begin to develop programs to help physicians and nurses, because we're truly in a public healthcare crisis right now with over 40% of physicians being burnt out. On top of that, the COVID-19 pandemic, the isolation, working long hours. This is the time to really begin to develop programs.
So, for those physicians who may be struggling with burnout, what kind of programs, what kind of expectations should they have as a result of this act going forward?
Yeah, what I hope the act does, it does three things. One, it educates the healthcare workers on the signs and symptoms of burnout through lectures so they can seek help. Because I know that in my story, I didn't really know the signs and symptoms very well. I always thought that playing football, you had to work through the pain, and I didn't actually know that. So I think one is letting people know what the signs and symptoms are. Number two, it really helps the developing programs or wellness surveys to track measures of success. And third, what it does, it develops wellness programs around a whole host of things. It could be nutrition, it could be exercise, it could be sleep. But really, what I would hope that it does, what I would love to see healthcare systems integrate wellness programs within a healthcare worker's workday. What I mean by that, because having these wellness programs before work or after work, it'd be great if every week healthcare workers had some dedicated time within their workday to really focus on these things. And I think that would be a very powerful message.
We're talking to Anthony Avellino. He's a pediatric neurosurgeon. He's the author of the book, Finding Purpose, A Neurosurgeon's Journey of Hope and Healing. Anthony, so I think that this piece of legislation is certainly just a start, but in your opinion, what more do you think needs to be done to address healthcare provider burnout?
Yeah, I think one of the most important things is to remove the stigma, letting the American public know that the mental health is real, and having the ability to come forward if they actually have any concerns. And what I hope the Laura Breen Act does, it really develops programs and removes some of that stigma so people are willing to come forward. Because I often say is no one should ever be at the brink as I was. And it's sad that Dr. Lauren Breen was at that brink. But what I hope comes out of it, I hope it gives people hope. I hope it gives people the opportunity to pause, and I hope it gives people to seek help, because there is help out there. I know, I've been through it, and it's really important.
Now, when you talk about this act to the public, to your colleagues, tell me how this has moved the needle when it comes to normalizing the stigma of behavioral health issues in the clinician workforce.
Yeah, what I think it does a few things. One, it enables the public to understand what physicians and nurses are going through. And I think the COVID-19 pandemic has been such a high profile within the media. It's not all glorified as some think. And so one, it gives the American public to really, this is a crisis. And then two, is what I hope it does. I hope it provides self resources so people can develop their self coping skills.
And my final question, what are some of your take home messages that you want to leave with the Kevin MD audience?
Yeah, it's my journey, and just being excited about the Lauren Breen Act is what inspired me to actually write my book. And really, in my book, what I sort of end with is my wife and I developed this. Life is like an ultra race. It's you must stay in the present and let the journey unfold. You need to celebrate your successes along the journey. But my wife and I developed an algorithm, and what I like to leave you with is your tactics. And what I mean by that is if you take each letter of that word, T is take time for yourself and lead a peaceful life. A is always eat healthy, exercise, and sleep. C is continually self-improve. T is treasure family and friends. I chose the day I have. C, control disappointments and respond positively. And S stands for you have to smile and laugh. So if you remember your tactics, but really having the ability to take a pause every day, having the ability to figure out what brings you joy, because life is a journey and you have to listen, you have to learn, and you have to heal.
Anthony, thank you so much for coming back on the show and sharing your time and insight.
Sure. All right, Kevin. Well, I very, very much appreciate this because this is really a very important step forward.